You're watching CTOM TV. Knowledge is power.
Don't ever underestimate the importance of diet and exercise in regards to cancer. I mean, I did a lot of graduate study research on that, and this is something I've been doing for a long period of time. Huge impact. Sometimes as much as the treatment. There's all kinds of things like, green tea, for example, could reduce PSA. And we've seen green tea. We had a case where we had a patient who was drinking green tea, and they had 8 tumors in their prostate. And after 2 years of drinking green tea every day, all day long, now they drank a specific type that had been used in a clinical trial and was tested for a high level of EGCG, which is the active ingredient in green tea. And they actually had all of their tumors disappear. And I didn't believe it. So they sent me their medical records, and I went over it, and sure enough, that was the case. Now, obviously, you want to know the genetics of a situation like that. You don't want to just be throwing some sort of thing at something. You want to know that there's overexpression of PIK signaling and AKT signaling, which is what the EGCG targets. You don't just want to throw something at something blindly like that. You want to use the science that is available there. So things like curcumin, EGCG, resveratrol, all can reduce cancer growth to a certain degree. And the way they do that is by reducing inflammation. Inflammation is a huge, powerful feeder of cancer. And anything you can do to reduce inflammation, even a daily baby aspirin can have a 5% reduction in death of prostate cancer patients. So daily aspirins. Exercise is huge. You want to be doing weight-bearing exercises at least 3 to 4 hours a week. You can significantly reduce cancer risk. And when you have cancer, you can significantly reduce the ability for it to spread. One of the reasons, as I mentioned, is other cells in your body compete with cancer cells for resources. One of those cells is muscle. So muscle competes with cancer cells in a variety of different ways. One of the ways it does is through a process called angiogenesis. Mm-hmm. So cancers use the recruitment of blood vessels through a process called angiogenesis. Mm-hmm. It's an incomplete process. The actual process that muscles use is neogenesis. And so angiogenesis is missing the last step. And what happens there is you end up with leaky blood vessels that are perfect for tumors, because then they can spread their cells throughout the blood vessel system, because the blood vessels leak. So when you lift weights, there's a limited amount of resources and hormones for blood vessel creation, and your muscles preferentially steal them from the cancer cells and limit the ability of the cancer cells to get their own blood supply. There's a multitude of different factors with weightlifting. There's just a muscle that is contracting produces a protein that reduces cancer, many different cancers. There's a multitude of different factors there. You're increasing also your lymphatic system is moving. You're circulating your immune system throughout your body. And then, of course, when you lift weights, what you do is you tear the muscles. Mm-hmm. And those muscles are repaired by a set of processes that cancer cells would normally use to grow and metastasize. And so there's a multitude of benefits. And we see this over and over again in clinical trials and studies. And then high amounts of fiber. So we spend a lot of time researching the biota. For example, in breast cancer, there was a recent study that showed that when women have a combination of soluble and insoluble fiber and either kefir or Greek yogurt, which is considered a probiotic, the fibers are considered prebiotics because they provide a molecular scaffold for these certain bacteria. There's a class of bacteria called Municipala that grow in the distal colon. And what they do is they produce these long and short chain fatty acids that actually activate an arm of the immune system called the gamma delta T cells. So normally the gamma delta T cells occur at a very low rate. They're about 3 to 5% in the body. But they are a unique type of T8 cell that attacks tumor cells without needing to be activated. And when you have a lot of fiber and probiotics and prebiotics, this allows the Municipala and many other bacteria species, is like literally hundreds of them, that also grow on the scaffold of fiber. And they produce these long chain and short chain fatty acids that activate these gamma delta T cells. So in a recent study they did, I believe it was Mayo Clinic, the women were on chemotherapy. They had estrogen positive breast cancer, and there was a 30% reduction in the amount of metastasis to the lungs in these women who took that compared to the placebo. So definitely a healthy vegetable-based diet, which is heavy in fiber, fish, avoiding land animals, have a steak maybe once a week or something, but heavy cold water fish and high fiber diet is really important for most cancers, and creating the biota that shuts down a lot of these signaling pathways that are involved in cancer. I mean, I could talk about this for hours with you, the individual pathways. It's not a cure. It's not to replace therapy, but you want to do everything you can, regardless of the impact, even if it's only a 1 or 2% impact on reducing your cancer spread.
So I have completely changed my diet. So as far as diet goes, I just eat fish and
Wonderful.
Salmon or
Excellent.
cod or haddock. And then I eat cauliflower and broccoli every day.
Wonderful. So maybe you are getting some reduction then, you know?
I think so. And in the morning I have berries, and I have
Excellent.
10 tablespoons. 10 tablespoons of seeds on there soaked in soy milk.
Excellent. Excellent. You're doing everything I would recommend there.
Now, and I went to the gym for 30 years, from age 40 to age 70. And then cancer came up, the pandemic came up, and I ended up losing a total of 40 pounds. I've gained about 10 back now. And that was because I was told to cut back on the metformin. I was taking metformin 500 twice a day. So
how come you're taking metformin?
It's in clinical oncology. It's in the COC protocol.
COC. So were you on the COC protocol?
Well, those things came from Dr. McKinney, the metformin, and also naltrexone 4.5 milligrams.
Good. Yeah. Very powerful anti-inflammatory. It has anti-cancer properties. Definitely. You know, all of these things have an impact. The COC protocol, it either works or it doesn't. It was developed in Germany a long time ago for brain tumors. They got some patients responding it to others that don't. A lot of our patients go on it. It really depends on the molecular basis of your cancer. Metformin is an mTOR inhibitor. So it targets that pathway that I said is expressed earlier on, the mTOR pathway. So metformin is a natural mTOR inhibitor. And it also reduces the need for insulin. So that's important. Cancer cells love insulin. Another approach you want to take is daily aspirin. I'm sorry, I mentioned that earlier, but statins,
baby aspirin, right?
Reducing cholesterol is really important. Having is a small amount of cholesterol. You want your cholesterol as low as possible. Beta blockers reduce cancer spreads. Statins. So, you know, these are things that most people can take to reduce the spread of their cancers, but these are really effective in prostate cancers. You know, they're not treatment, but they're part of integrative therapy. So if you are going to do integrative therapy, use science-based integrative therapy. Get it off PubMed.
In terms of supplements, you know, I take about 60 pills a day.
Okay. So if you do take supplements, there's been many studies, there's consumer testing, that the vast majority of supplements not only contain not what they propose to contain, but they also contain some dangerous heavy metals and lead and cadmium and things that actually are carcinogens. So if you do supplements, go to a site called consumerlabs.com. They are an independent testing lab. And what they do is they go into stores, they buy vitamins and supplements and green teas, and they test them and they look at them, and then they report on their website what they found. And then they'll provide you links to the ones that pass their scrutiny so you can get them for a discount.
I don't buy supplements at the health food store.
Just get them through consumer testing. I was quite surprised because one of the best olive oils and one of the best forms of curcumin was actually from Costco, but it was only a certain brand that they sold. So definitely, if you're going to use supplements, only use tested supplements, because some supplements are really bad. And in fact, the ones that the naturopaths that sell in Canada, the naturopath brands, 9 out of 10 of those contain cadmium and dangerous toxins. So there's been lots of independent testing on supplements. There's no regulation of them. So only use supplements you get that have been reviewed through consumer labs.
And I guess I have to admit that the stuff, the NFH stuff that I've been taking, and I buy it directly from NFH now, that was as a result of Dr. McKinney's recommendations, what he did. So additionally, I do take 6 ounces of pomegranate juice every day, along with unsweetened soy beverage and
Wonderful.
a teaspoon of Matcha green tea.
Nice. Matcha,
along with protein powder.
Yeah. Good. It sounds like you're on a really good diet plan right now for your type of cancer. That's great.
Yeah. But still,
get your PSMA PET, and then I'll be happy.
If I could get better sleep, but sleep for me has been a lifelong issue, and I believe that started around the age of puberty when I had a serious concussion.
Oh, yeah, I understand. I'm lucky if I get 2 hours sleep a night too. I'm always tired. I take a nap in the afternoon to compensate, but it's.
But you're right to think that, Jeffrey. Certainly a brain injury can definitely affect your ability to get restful sleep. Sure. Yeah. And I do just want to sum up what Alex was saying about the supplements. Obviously, there is some good clinical data, and again, back to mechanisms, some well studied and defined mechanisms that make certain supplements, we'll say, proven to directly influence cancer, like curcumin, you've heard of, I'm sure,
I'm taking it, yeah.
Yeah, like the EGCG and a couple of others. So and yes, unfortunately, there isn't a lot of regulation in the industry. So overall, we are in full support of supplements, assuming there is a proven mechanism and that there is a consumer report indicating that this particular brand has in it what they say they do. So with those extra caveats, which make all the difference, because what would be the saddest is for people to be taking all these pills and going through all this process and having it affect them not at all. So if you're going to go through all the cost and trouble of these supplements, let's make sure they have a proven mechanism and that they actually have in them what they say they do. That's all I want to say about that.
So additionally, I for about 18 months or so, I've been taking a cannabis suppository every night for the, pardon?
CBD?
Well, it's got a lot of CBG in it too. It's got frankincense in it. It's seems to be a pretty good. I get it supplied from the island, and it seems to be a pretty good. And recently, he just got an incredibly stronger CBG than he previously did have in it. So
we're back to check PubMed. What does the data say?
Yeah.
There's
not a lot of positive data on marijuana products in regards to reducing cancer, but it's got lots of other benefits for cancer patients and anyone who wants to use it. And it stimulates appetite, relaxes people, gives you a better headspace in many occasions. So there's lots of positive benefits to it, but don't be fooled into thinking it actually has anti-cancer property. It's probably no better than salad or something.
Well, when I take it as a suppository, I don't. There is quite a bit of THC in it, but I don't feel it at all.
Oh, interesting. Okay. Maybe you're used to it.
Well, it bypasses the digestive system.
Right. Yes. Yeah.
So the whole point is, if you're going to go through that process on a daily basis, let's make sure that what you're doing has merit.
Thank you for watching Ketome TV. Subscribe below and stay informed.